My name's Luke McDonald. I'm a third-year medical student at Dalhousie Medical School through the New Brunswick stream, and I'm currently doing my clinical rotations in my third year at the Miramichi Regional Hospital. Even before I applied to medical school, I had a very strong interest in psychology and in the field of, mental health, behavior, personality, all those types of things always kind of fascinated me even since I was young. So I did some job shadowing, observership with Dr. Sanjay, Dr. Siddhartha here in Miramichi, psychiatrist, and he kind of introduced me to the field of psychiatry at a very early stage in my education and showed me not only what it meant to be a psychiatrist, but to be a psychiatrist in a town like this town and in a rural community. And I would say from that point up until now, almost finished medical school, I've been very fixed on working towards that dream and hopefully becoming a psychiatrist and working in a similar place, if not this place. Bipolar II disorder is a mental health condition, and it's characterized as a mood disorder, which means that it is a disturbance in mood of some sort. And with bipolar disorder 2 specifically, it's characterized by fluctuations in mood states, specifically mood states known as depression and hypomania. Depressive state in bipolar II disorder actually looks a lot like depressive states that we might see in other mental health conditions, including bipolar disorder type 1, and then major depressive disorder and other forms of depression as well. So what that might feel like for somebody is oftentimes symptoms like low mood, not feeling like they feel like themselves. They may feel low motivation, not as much interest or pleasure in things that they previously had enjoyed. And in a lot of individuals, they may experience significant disturbances in their sleep patterns, their appetite, to the point where their weight changes. And in the severe cases, we often will see as well people experiencing thoughts of suicide, self-harm, and attempts at those as well. Hypomania is a very interesting thing for a patient to experience in the sense that subjectively they often feel quite good, in the sense that it is defined as an elevated or an expansive mood. There can be features of irritability as well, so these individuals might feel as if their patience is a little bit thin, or they may be talking, a lot more than usual, but they may feel as if they have more energy than usual. They might feel very productive. They might feel that their mood is higher than normal, and it's hard for these individuals when this is happening to often recognize that something may be happening in terms of their mental health because of the way that they feel. On the other side of things, though, hypomania does have some negative consequences. They may have things like impaired judgment or be engaging in behaviors that may not necessarily be in their best interest, like engaging in high-risk behaviors, things like infidelity, or engaging in practices like risky sexual practices, or issues with alcohol or substance use, and things like that can often be an issue in this population because of the lack of impulse control that might be present. Patients with bipolar II disorder more often than not will have a co-occurring mental health condition as well. So up to 75%, so 3/4 of people who have bipolar II disorder will have a co-occurring anxiety disorder. And that could mean anything from generalized anxiety disorder, could also include things like social anxiety or post-traumatic stress disorder and things like that as well. Another thing that's really common in this population is substance use disorder, and many of us are familiar with what that means and what that may look like, and this may be a result of individuals in an attempt to self-medicate for what mood symptoms they might be experiencing, or also because of that loss of impulse control that is often accompanied by the mood episode that they're experiencing. Bipolar II disorder is a complex condition when it comes to treatment and management, but it is manageable for sure. It's just something that has to be very individualized when it comes to the patient. So there are going to be many patients who present very differently from case to case despite having the same diagnosis. So oftentimes when it comes to treatments like medications, things like mood stabilizers will be utilized. And this would include, to name a few, things like lithium, lamotrigine, quetiapine would be some examples. But it's going to depend on essentially what that individual's clinical profile is. So if they are a patient who is more prone to experiencing a hypomanic episode or symptoms of hypomania, we may opt for a mood stabilizer that has properties that will be better able to rein in those symptoms. when an individual is diagnosed with bipolar 2 disorder, because there are a lot of misconceptions about this type of mood disorder. Not everybody knows exactly what bipolar disorder is, and a lot of people aren't aware that there are different types as well. So it's going to be really important to be able to provide education to these folks to make sure that they know exactly what illness it is that they have and how to kind of track their symptoms over time, their mood patterns, their sleep patterns, their activity patterns, the way that they engage with their treatment is going to be an important piece of that as well. So coming up with a good plan to make sure that you're well informed as a patient and monitoring how things are progressing over time is important. And then making sure that you do have a support network in place, be that, a spouse, family members, friends, loved ones. And there's always things like the Mobile Mental Health Crisis Response Team and the 988 crisis phone and text line as well that can be accessed in various communities across New Brunswick.